Very good morning, everyone. I'm Dr. Priya Singh. I'm reader in the Department of Oral Medicine and Radiology, BBD COTS, BBD University. And the lecture that I'll be dealing with today is Introduction to the Specialty itself. Now, when we talk about oral medicine and radiology, there are three very important aspects of this particular specialty. They are oral diagnosis, oral medicine, and oral radiology. So all these three aspects will be dealing with under history, scope, and definition. Now coming to oral diagnosis. Now oral diagnosis, it's basically derived from a Greek word which means thorough knowledge or complete knowledge when it comes to a particular pathology. It is basically defined as an art and science of identifying an oral disease from its symptoms and signs. Now, it's very important aspect to learn about the terms symptom and sign because you'll be using these terms very frequently when it comes to medicine, when it comes to dentistry. Symptom. A symptom is basically defined as any bodily change which is perceptible to the patient or the complaint with which the patient will come to you. Patient will come to you with pain. Patient will come to you with mobility. So these are symptoms. Whereas a sign is defined as any bodily change perceptible and to or elicited by the trained observer himself or herself. Now, just for example, pain is a symptom, but there is visual analog scale or VA scale by which we can convert this symptom into sign and we can classify pain into mild, moderate, and severe. Now, there are basically four signs. There can be clinical sign. Clinically, you can see that there might be loss of stippling, which is basically, it comes under pathology of gums, gingiva. So loss of stippling means inflammation in the gums. Laboratory signs, which can be in the form of positive RA factor. Radiological sign, which might be radiolucency, radioopacity, or a mixed lesion present. Histopathologically, it can be breakage of the basement membrane. So the signs which we usually classify clinically may be depending upon the soft tissue clinical signs and hard tissue clinical signs. Diagnosis. How a diagnosis can be made? There are three very important aspects by which you can come to a diagnosis. First of all, the case history. Case history, which comprises of the chief complaint of the patient. So it's usually said that we should listen to the patient attentively. Patient himself or herself is giving you the diagnosis. So the case history has to be recorded very nicely in the patient. Second is the physical examination. Now, physical examination can be general, extraoral, and intraoral. Now, depending upon the physical examination of the patient and various aspects of it, we can think of a working diagnosis. We can think of the pathology which is more probable in the patient who has presented to you. On the basis of that particular sign and symptom, we want to confirm it. So confirmation can be done by investigations. Now, investigation will help us to come to a certain diagnosis which we can confirm with the confirmation of our investigation report. Now coming to oral diagnosis, case history. It's a very important aspect. It is defined as a planned professional conversation which enables the patient to communicate his or her symptoms, feeling and fear to the clinician and is recorded in patient's own word so as to obtain an insight into the nature of patient's illness and his or her attitude towards them. So as I told you earlier, very important that in case history, you should listen to the patient attentively because the patient himself or herself is giving you the diagnosis. So don't interrupt the patient when you are taking the case history. Once you are done with the chief complaint of the patient, then through leading question, you can elaborate on the chief complaint of the patient. Prognosis. Now, this term also you'll be using very frequently. It is the prediction of the nature course, how the particular pathology will follow its course with or without intervention. That is, if our treatment is given, how it will proceed and if the treatment is not given, then how it will proceed. So prognosis can be poor or good in a patient. Provisional or tentative diagnosis, very important aspect. It is a preliminary educated conversation to identify the nature of the condition before all the diagnostic data is assembled. Clinical diagnosis, this is the diagnosis arrived at after considering only the clinical signs and symptoms. Working diagnosis, this dictates the proper management, that is, it allows the clinician to work. That is why it's been given the name of the working diagnosis. If a working diagnosis of irreversible pulpitis is reached, it indicates to the clinician that endodontic therapy or RCT will be required in the patient. Differential diagnosis. Now, this aspect at times very difficult for people to understand. Differential diagnosis is basically rearranging a list of pathologies which will mimic each other, and the probability of the pathology which is the highest is usually kept at the top, followed by the probability of less likely at the bottom. Throughout the diagnostic process, the aim is to keep narrowing the list of differential diagnosis. Now, how can we narrow this DD? We can narrow the differential diagnosis by doing investigation and eliminating the pathologies. If I'm giving you one example, if in case there are 5 differential diagnoses, the investigation to confirm that particular diagnosis, first, the most highest pathology, the investigation required should be done. If it has not confirmed it, it is removed from the list, followed by the rest of the pathology in the list. And that is how we can come to the final diagnosis, which is a definitive statement stating the identification of a disease along with its etiology. Example, pulpitis, along with its causes, which can be caries or hypersensitivity. Sometimes final diagnosis may be arrived at after initial treatment and observing the response to the treatment. At times, the investigation might be very cumbersome and not necessary that all the investigation will give you the final diagnosis. Giving you one example, if in case you are suspecting patient having neuralgia, what you can do, you can give treatment of neuralgia, which is anticonvulsant. Following the anticonvulsant, if the pain is completely relieved, it gives you indication that your diagnosis is correct. So sometimes the initial treatment will give you insight into which pathology the patient is being affected with. Same is with traumatic keratosis. If trauma is because of a sharp cusp tooth, then if you grind the tooth, the traumatic keratosis with time will completely relieve, will further give you the indication that it's no other pathology but traumatic keratosis. Then coming to scope of oral diagnosis, the scope will come under the oral diagnostic process itself, concept of provisional diagnosis, clinical, radiographic and laboratory investigation in the diagnostic process, concept of differential and final diagnosis. Then on the basis of this, the treatment planning, prognosis and follow-up. So different pathology will have different prognosis, and depending upon that, we decide on, at times few patients might not require any follow-up because we are sure that whatever treatment has been done is the final eradication of the pathology itself. But in few pathology which we know that has recurrence, follow-up will be required. Interdisciplinary approach in diagnosis and treatment, where you will refer the patient to different department where you want that patient should be completely eradicated of the pathology. At times, more than one treatment will be required in the patient. Then coming to the second aspect, that is oral medicine. Burkitt's, the 10th and 11th edition has given the definition of oral medicine. It is the specialty of dentistry that is concerned with the oral health care of medically compromised patient and with the diagnosis and non-surgical management of medically related disorder or condition affecting the oral and maxillofacial region. Oral medicine specialists, they are basically concerned with the non-surgical medical aspects of dentistry. These specialists are involved in the primary diagnosis and treatment of oral disease that do not respond to conventional dental or maxillofacial surgical procedure. So as a specialist of oral medicine, we have to not only see the area of chief complaint, we have to even visualize the area adjacent to it, because at times the adjacent area might be the origin of the pathology. So very important to identify the patient in totality. Now coming to brief history of oral medicine. Sir Jonathan Hutchinson in the year 1828 to 1900 has worked tremendously in not only oral medicine but medicine. He worked as a surgeon in London Hospital. He proposed the dental manifestation of syphilis. He did research on intraoral pigmentation. He can be regarded as the father of oral medicine because of its tremendous contribution to this particular specialty. Now, oral medicine, as you can see this particular image, it basically comprises of mouth mirror and explorer, which is represented by X. X is nothing but oral radiology, which indicates or denotes X-rays. In India, oral medicine and radiology is an emerging specialty of dentistry, and it hopes to set a shining example, which is represented by the star in it, in healthcare, research, academics, education, and ethics. So this is the emblem, and these are the reasons from where it has been derived. Oral medicine encompasses diagnosis and medical management of diseases of the oral mucosa, jaws, and salivary gland. Diagnosis and medical management of facial pain and temporomandibular disorder. Dental treatment for patients with complicated medical diseases. So not only oral manifestations has to be seen, but at times systemic changes in the patient can be seen first time by an oral physician. Our oral physician can be the first one to see signs of certain systemic disorder. So we have to even keep an eye on the medical diseases of the patient. Medicine cures rarely, comforts mostly, but should console always. With this, we can be a good oral physician and maxillofacial radiologist. Now coming to the last aspect of this specialty, which is your dental radiology. Just a brief history into dental radiology. In a darkened room on the night of November 8, 1895, a tiny bit of fluorescence, which was to enlighten the entire medical world, was noticed by Sir Wilhelm Conrad Roentgen. Though it was an accidental discovery, but it has opened a wide avenue, and we can see into the vicinity of our individual. We can see the changes in the heart tissue of our individual. He noticed a faint glow more than 6 to 8 centimeters away when this fluorescence thing happened in the Hittorf-Crooks tube. He realized that he was observing a new form of energy. And this new form of energy, as you can see in this image, Sir Wilhelm Conrad Roentgen, and this new form of energy, he called it as X-ray. X-ray because till then, it was not identified what actually it was. So this is the first radiograph of Sir Wilhelm Conrad Roentgen's wife finger, where you can see the wedding ring in the finger. So this is the first radiograph in the history of mankind. Koenig, Volkoff, and Harrison, they were the first dental radiologists, and they had taken the first dental radiograph in the year 1895 itself, when the X-rays were discovered on 8th November. Dr. Edwin Kells, first in the USA to make an intraoral radiograph. Dr. Weston Price formulated the bisecting angle technique in 1904. Dr. Franklin McCormack discovered the paralleling cone technique in 1910, just 6 years following the bisecting angle technique. Dr. Howard Raleigh Rapper, he is the founder of bite wing radiograph in the year 1924, which is much later. Now, few definitions which are very important: radiology as well as radiography. At times people confuse between the two, what it basically implies and how they differ. So radiology is defined as a science composed of technical and interpretive procedure that interdependently result in useful diagnostic data. Whereas radiography is defined as an art and science of producing photographic images of tissue through use of X-radiation. Radiology, it has a wider connotations. It involves making as well as interpreting the radiograph. So you can do the procedure itself, as well as you can interpret the radiograph and then formulate a radiographic diagnosis. So dental and maxillofacial radiology, it is the specialty concerned with non-neurological head and neck imaging with particular reference to teeth and jaw. Those specializing in the discipline are expected to be competent in advanced organ imaging in these areas. It involves all aspects of medical imaging, which provides information about anatomy, function, and disease states. So now we know that all these three aspects are inherent aspects of specialty, that is oral medicine and radiology, and we cannot separate them. So diagnosis, medicine, and radiology being the integral part, knowledge in all these three aspects is very important to being an oral physician. Thank you.